Hi, my name is Sally. I was born in South Africa, and over the last 35 years or so, I have grown into profound deafness. This was only detected in my late 20s. Why was this missed? My mother wore a hearing aid. The delay in diagnosis certainly impacted on my education. I was frequently called Sally the stupid one or Sally the lazy one. When it came to social inclusion, my maturation progress was really slow. I lagged behind the others. I couldn't get the whispers about are we going to movies or if there was a party happening. Up until the age of around about 11 years old, I suffered really badly with ear disease. I used to have many chronic ear infections, buckets of antibiotics, and burst eardrums. By my mid-40s, I had profound hearing loss, and I was starting to rely completely on lip reading for communication. It is so easy to lose your independence and control in your life when you have a hearing loss. I would sometimes go into the work and ask somebody else to make a phone call, an appointment to see a doctor, and your privacy just goes out the window. It is easier to withdraw, not to go to social occasions where you know you won't hear somebody asking you a question, and if you give the wrong answer, you really look silly. No one talked about hearing loss when I was growing up, and that is still the same today, whether it's in a family or in communities. It's something that is not discussed. So, has anything changed? Yes, in 2002 in southern India, I met a little girl of 5 years old. She was in class, bright as a button, signing away to the teacher and enjoying school. She was diagnosed at 18 months. However, her sister was only diagnosed when she was 7 years old. And here was a huge difference in the progress that these two children were making at home, socially, and at school. Due to CBM's intervention and support, the primary ear and hearing care resources have been used around the world. This was done with the World Health Organization. We have trained healthcare workers of various levels in many different countries, and they have been translated into many different languages. So how did I come into the field of deafness? Well, at school, in secondary school, my schoolwork started to go down. Again, I was labelled lazy or stupid. I failed my third year in secondary school, went to teacher training college, and I failed my final year. Well, Sally's definitely lazy. At the age of 27, I was sitting in the staff room with a teacher on either side of me, and they were chatting and then asked me a question. I turned to them and said, "I'm sorry, I don't know what you're saying." They then worked out that I hadn't been able to turn my head fast enough to see what they were talking about. They suggested I have a hearing test, and that was quite traumatic. I found out that I had lost 40 decibels in one ear and 30 decibels in the other. I started wearing bilateral hearing aids. I taught for 17 years in a primary school, but towards the end, I was really tired and stressed. I could no longer hear the children as well. I was faced with this big hole. It felt like looking down a black pit. How was I going to support myself and my daughter? Would I be able to work anywhere again? And that was quite a difficult period to go through. I restudied design and technology and became director of a teacher training college in design and technology in Cape Town. After a couple of years, I moved to Geneva and met Dr. Andrew Smith, and together with CBM support, we developed the primary ear and hearing care resource. And this has been a very positive effect on millions of people's lives. When you lip read, you're continuously exhausted Going into meetings was always very stressful, as I had to turn my head and discover who was talking and what were they saying. So in a work situation, the stress levels were always heightened. I moved to Ireland and restudied again hearing and communication therapy, or oral rehabilitation as it's called, and I deal with children and adults with acquired hearing loss. I was extremely fortunate in 2009 to have a cochlear implant. This was life-changing. I could hear the birds. I could suddenly recognize some of the music that I had missed over 20, 30 years. But most important of all for me was to be able to pick the phone up and call my daughter on my mobile phone. I hadn't been able to do that for about 15 to 20 years before I had a cochlear implant. I understand the impact of hearing loss, and along with that comes fears, isolation, and the feeling of powerless. This underpins my passion and drive to make a difference where at all possible, so that no other child or adult goes through that whole process isolated. How do we deliver a support program if we have little or no understanding of what hearing loss feels like? I am extremely fortunate to have had the supports and technology to get through my life. Without CBM's investments, millions of people in low, middle-income countries will be left without that lifeline. Thank you.